Hi everyone, my name is Andrew Caporaso. I'm a survey methodologist at Westat. Thanks for tuning into my presentation today. The title of my talk is Impact of the COVID-19 Pandemic on Data Collection Outcomes in a National U.S. Health Survey. Like many of you, we were in the field last year when the pandemic was declared, and relative to the previous year data collection, we saw an increase in our response rate in 2020. So we wanted to explore whether that boost in response was attributable to new types of people responding to the survey during the pandemic. So the health survey that we're talking about today is HINTS, the Health Information National Trend Survey, sponsored by the National Cancer Institute. It's a cross-sectional survey that's fielded annually to a sample of about 14,000 households using an ABS frame. It's a paper and pencil survey. It takes about 30 minutes to complete, and it includes a number of health-related topics with a focus on health information seeking and information about cancer. So last year, HINTS 5 Cycle 4 had been in the field for about 2 weeks before the WHO declared that COVID-19 was officially a global pandemic in March of 2020. Relative to Cycle 3, which was in 2019, Cycle 4 saw about a 3-point improvement in response. Here are the overall response rates for 2019 and 2020. I've also broken those out by our two sampling strata, our high minority and low minority strata, which both saw a similar improvement in response rate between the 2 years. This chart shows the cumulative response rate over the field period for 2019 in blue and 2020 in red. The x-axis is the days in the field period and the y-axis is the cumulative unweighted response rate. In 2019, we fielded the survey about a month earlier than we did in 2020, but I've overlapped the charts here as if the two field periods started at the same time. You can see that the pandemic declaration occurred pretty early on in 2020, while we were still seeing a pretty healthy rate of returns from our first survey mailing, which always garners the most response. The response rates in 2019 and 2020 start to separate after mailing 2, which is sent about a month after the first survey mailing. And so this boost that we saw in 2020 appears to occur after the second mailing, which occurred in April. We kept the field period open a little bit longer in 2020 because we were still seeing returns coming in. However, you can see that the boost in response is kind of already baked into the cake at this point, and we didn't get too many more questionnaires during this extra field period time that we didn't have in 2019. So to look at response timing in another way, the gray bars here show the proportion of returns received after day 16, which corresponds to when the pandemic was declared in 2020. And the black bars show the proportion of returns after day 28, which corresponds to the start of the second mailing period. You can see that 2020's proportion of responses after day 16 is similar to what it was in 2019. However, there's a substantially larger proportion of responses coming from the second and third mailings in 2020 than we saw in 2019. So this suggests that the pandemic had an impact on response. It was slightly delayed and didn't quite manifest right when the pandemic was officially declared. So over here, I'm showing the 2020 results as if we restricted the field period to be the same time as 2019, just to show that our boost was not attributable to just having a longer field period. So one other interesting response outcome finding was that the boost in response in 2020 appears to be larger in the Northeast census region and in the South, while the boost that we saw in the Midwest and the West was not quite as large. So our main research question for this presentation is, did different types of people respond to HINTS in 2020 than in 2019, presumably because of the pandemic? To answer this question, we compared demographics and key survey outcomes between the two data collection years, and our analytic approach was as follows. We computed logistic and linear regression models controlling for 3 factors: the year of data collection, the response timing, whether the survey came in late, that is from mailings 2 and 3, or if it came in early from mailing 1, and then the interaction of these two factors. So the interaction term is meant to establish whether the late responders were different in 2020 and 2019, since the new people in 2020 appeared to respond later in the field period while the pandemic was underway. Okay, on to the results, starting with our demographic analyses. So each row of this table represents a separate model for the listed demographic group. The 3 columns represent the parameters I described in the last slide. Green stars represent significant positive effects associated with the parameter on the outcome, and red stars represent significant negative effects. So for example, we saw no significant difference in the proportion of 18 to 34-year-olds by year of data collection. We saw significantly more 18 to 34-year-olds in the late mailings than the early mailings, and the interaction between year and response timing was not significant. So this difference by mailing was consistent across 2020 and 2019. So looking at overall, none of the demographics were significantly different by year of data collection. There were a ton of significant differences by early versus late mailings. So this is a good advertisement for why you should send multiple mailings when fielding a survey. And there were just 2 demographics where the interaction term between year and response timing was significant, and I'll talk a little bit more about those now. So for non-Hispanic African American respondents, we saw a higher proportion in the late mailings in 2020 than in the early mailings, and that was a pattern we did not see in 2019. However, the main effect of year was not significant, therefore the overall proportion of this group was not different by year. Conversely, we saw a smaller proportion of non-Hispanic white respondents in our late mailings in 2020 than in 2019. And this difference was a bit more dramatic in 2020 than it was in 2019, but there is still no main effect of year in the size of this group. So now we turn from our demographic analyses to looking at key survey outcomes, starting with health communication outcomes, where we did see some significant differences by year. There were fewer people who reported seeking cancer information in 2020 than in 2019. I'll talk a little bit more about this in a second. In 2020, more people reported using the internet to communicate with the doctor's office and to make appointments with healthcare providers. And there were also more people who reported using their online medical record to download health information. I think these outcomes make sense with the increased use of telehealth during the pandemic. It makes sense that these behaviors be more frequent in 2020. However, we did not see an increase in these behaviors among our late responders who responded during the pandemic. So looking at the differences in the rate of seeking cancer information, the difference by year was somewhat unexpected. This question did change locations between the 2019 and the 2020 survey, so it's possible that this change in the way the question was fielded contributed to the significant difference in reporting. However, it does look as though the late responders were more different than the early responders over the 2 years, so this is an interesting outcome that we need to examine further. For using online medical records to look up test results, there was no significant difference by year, but late responders in 2019 did this more than late responders in 2020. This pattern may be related to people having fewer medical tests during the pandemic in 2020, but this is also something we need to examine a little more carefully. Okay, so this table summarizes the results for some health, attitude, and behavioral outcomes. We did not see any significant differences by the year of data collection, and we saw a few differences by response timing. There was a significant interaction effect for variable asking about the experiencing financial difficulty. Late responders in 2019 were more likely to report financial difficulty than those in 2020, which might be the opposite pattern we'd expect to see given the rising unemployment rates that occurred during the pandemic in 2020. There was also a weak interaction effect for the minutes of weekly exercise. Late 2020 responders reported slightly more exercise than late 2019 respondents. However, there's no main effect of response timing or year for this variable, so it's not a very strong effect. So to wrap up, our findings support the notion that the pandemic contributed to our increased response rate in 2020. The boost in response that we observed came later in the field period when stay-at-home orders were being implemented around the country. We didn't see a similar jump during the same point in the field period in 2019. While we got an improved response rate in 2020, it does not appear to be attributable to different types of people than we got in 2019. There were no significant differences in demographics between the 2 years. One possible exception is that we got a higher response rates from the Northwest and South census regions, but there were no differences in terms of household and respondent level demographic characteristics. While there were a lot of differences between our early and late responders, these differences were largely consistent in 2019 and 2020. There's some evidence that more non-white people responded late in 2020 than 2019. And there was also some significant differences by year in key survey outcomes that I described over the last few slides. Some of these differences were expected, like more use of telehealth, while others like seeking cancer information were less expected and worthy of further examination. So our findings are helpful for understanding what to expect in the next pandemic. As far as what they suggest about survey methodology more generally, I think they provide evidence that availability at home is not a substantial driver of response bias issues that are common to mail surveys. So while Americans were perhaps more at home than they've ever been in recent years, we did not see substantial gains in response from our commonly underrepresented groups like young people, non-whites, and people with lower education. Multiple mailings and contact attempts were helpful at improving representation from these groups, but the results from 2020 suggest that different interventions are necessary to improve representation. This isn't exactly a novel conclusion, but I think this analysis was a helpful confirmation that we need to continue to think outside the box to improve the quality of our survey research endeavors moving forward. And we hope to continue to use HINTS as a vehicle to explore new approaches to improving response and survey methodology. So thank you so much for tuning into my presentation. If you have any questions or comments, please don't hesitate to reach out. And I hope you enjoy the rest of your AAPOR. Thanks.